ladies and gentlemen, I call the lady that you just heard from the hardest working person in mental health in Mercer County. She is the face of Stamp Out Stigma in our community. One more time, loud as you can. First of all, thanks for coming. Wow. Penn State, before I start, I just want to say, y'all look amazing. I see some of you came out to represent the campus today, student government. I see you guys. Y'all ready? I see you. Wendy, I see you in your tutu. You look especially nice. I want to thank y'all very, very much for coming out and representing the campus. This event would be nothing without all of you, and I appreciate you being here. So, as you know, this is an annual event. This is our 3rd annual Stamp Out Stigma. And because it's an annual event, we like to pick a focus each year. This year, we have chosen to pay attention to substance addiction with a particular eye toward opiate addiction. In case you folks don't know, in case you haven't been in the vicinity of a television, newspaper, or social media for the last year, we are currently in the midst of the deadliest drug epidemic our nation has ever seen. And they say if you want to change the world, you should start in your own backyard. So let's talk about home. Let's talk about Pennsylvania. Last year, we lost 2,500 approximately Pennsylvanians to drug overdose. In 2014, we lost 2,500. In 2015, last year, we lost 3,500. And this year, the numbers aren't in yet, but we are on pace to eclipse that mark again this year. The numbers vary. A lot of drug overdoses and deaths involve polydrug toxicity. That's more than one drug that is present in the system. However, it's estimated that 60 to 80% of overdose deaths, opiates are present. When I say opiates, I use it as a blanket general term. I'm speaking both of prescription opiates, such as oxycodone, hydrocodone, fentanyl, and morphine, and I'm also speaking of diamorphine, the street drug that you folks probably know as heroin. So I'm using it as a blanket term when I talk about opiates. So we are in the midst of this crisis for many reasons. There are a lot of compounding factors, but I have identified two. And at this point, I'll stop and say I'm going to be sharing some facts with you folks during this presentation. I'm also going to be sharing some opinions. These are my opinions. They don't reflect that of Penn State, my employer, my co-presenters. They're my opinions. A lot of you won't agree with me, and that is okay. I only ask that you please keep an open mind. So, two things to blame for the mess that we are currently in. One, the overprescription of prescription opiates in the United States. On a state level, we have finally recognized that there is a problem. Governor Wolf spoke on September 28th, and he announced some measures to combat overprescription of opiates. He said the state will allocate approximately $20 million to 40 treatment centers. It was unclear from what I read if those are new treatment centers or existing treatment centers that will help an estimated 11,000 Pennsylvanians that are seeking treatment. That is good. More of that. We need to see more of that. The $20 million is a start. I will take it. They have also taken the measure of restricting opiate prescriptions when you go to the emergency room specifically. They're going to be giving people less opiates, about a week's supply. If you seek treatment in the ER, they're wanting you to follow up with your physician, with your family doctor afterwards to get more. They are also changing the requirements for a state database that requires, if someone seeks a legitimate opiate prescription from their doctor, previously, you had 72 hours to put it into the database. They are reducing that to 24 hours now. That is to prevent doctor shopping. That is to prevent people from going to provider seeking opiate prescriptions. I think these restrictions are fantastic measures if we had them in place 10 or 15 years ago. I think they are too little, too late now. What I fear is that people who are already dependent are going to go to the street to seek illicit prescriptions or heroin, which is more and more regularly being adulterated with more dangerous substances like fentanyl and carfentanil. I think this is bad. Also, opiates have a legitimate medical use. I fear that these measures will prevent people who actually need them, someone who breaks their femur, and goes to the ER from getting pain medication to make them comfortable. I think these measures would have been great in about the year 2000. Now I see them causing more problems. So, overprescription, problem number one. Problem number two, the failed multi-million-dollar, billion-dollar war on drugs that our country started waging in the 1980s, which mainly went after street-level users and incarcerated them, removing them from their community and professional supports that they would have needed to get better. Of course, people reoffend when they get out of jail. Jail is not rehab. So we started waging a war on drugs in the 1980s. On the low, the government has admitted that the Just Say No campaign was a huge failure. I would say we have evidence that it's a huge failure. I mean, look at the mess that we are in right now. So in my view, we have the doctors and the pharmaceutical industries for overprescribing these drugs, and we have the federal government to blame for putting us in this mess, which is killing approximately 10 Pennsylvanians every single day. So, as Fern said, we stamp out stigma because we want people to seek treatment. We want people to seek professional help. That is the end game of this. This is why we want to encourage conversation. That's why we want people to talk about it openly. We want people that are suffering to get help, and we want those close to them to be understanding and supportive of them in seeking treatment. Now, I know that second one is really, really hard. You may know someone that is battling substance addiction. They might be fighting you every step of the way when you are trying to get them to go to treatment. It's frustrating. I've seen it happen. What we have to do, even though those people might be fighting against us, what we need to do is support them. We need to hold them closer than ever. I have heard it said about folks that are in active addiction that he or she just needs to hit bottom. They just need to hit bottom, and then they will have a wake-up call. Something I learned in recovery that has stuck with me is that you don't hit bottom until you stop digging. We must not wait for these people to bottom out. We have to reach down into that hole that they are digging and try our best to lift them out of it. We want people to get help. That's why we're holding this event today. So, how do we stamp out stigma? How do we do it? Stigma is born of ignorance. Ignorance, just to be clear, does not mean stupidity. Ignorance means not knowing. So the number one way we're going to stamp out stigma is through education. I would have loved to take some time today to educate the people about opiates. Something that I've learned this last year in the events that I've gone to and the reading that I've done is that people's understanding of opiates and addiction is kind of all over the map. And that's okay, like wherever your level of understanding is, that's fine. But I encourage people to get informed, read. And I don't just mean read sensationalist news articles, I mean read. Find out what opiates are. Find out what they do to your brain, to your body. Recognize the signs of addiction. If you don't know, there might be somebody in your circle struggling and you cannot recognize it. So please, inform yourselves. Now, once you yourself have become informed, there are others among us who have the obligation to inform others. I'm in a university right now. Teachers, hi. My esteemed professors, I see some of you, Joan, hi Joan, Roxanne, Kara. I ask you ladies, there's probably some other educators in the room not recognizing right now. Take some time, just cut something out of your syllabus and teach your students about opiates. Teach them about the crisis that we are currently facing. And I don't just mean facilitate a classroom discussion and talk about feelings, I mean teach facts. I feel like all of us that are in a position to share information should do so. Another group that should become informed, nursing students? Nursing students? Hi. You're going to encounter opiate addiction in your profession, right? People that are drug seeking, people that are already dependent. You're going to encounter it. Inform yourselves. Very important group. Parents. I am not a parent, I'm just demonstrating. Hands up. Thank you. Okay. Parents of teenagers. Talk to your kids about drugs? You do? Wendy? What have you talked to your kids about?
About what the drugs are.
What they are?
What they are, what they'll do to you. If someone tries to give you something at school or your friends, walk away, how they destroy your life, how they kill you.
More of that, please. More of that. If you haven't talked to your kids about drugs, parents of teenagers, inform yourself, then talk to your children. It's important, and again, it's important that you teach them facts. Saying just say no doesn't always work. We all take risks when we're teenagers. Please teach them facts. I implore all of you in the position to educate others to take the opportunity to do so. So, that's how we're going to stamp out stigma, education. Number two, how are we going to stamp out stigma? With examples of recovery, like me. Every time I take this stage, I share with people, I went to rehab 5 years ago before I ever got back to campus. It was before I ever came back to this campus. It was one of the best decisions I've ever made. Please, if you're suffering, get yourself some help. I stand up here every year and say that, and at this point, it doesn't even faze me. Like, my business is out there. I wish more people would do this. I wish more people would stand up and say, yeah, it was me. Addiction doesn't discriminate. It's okay to say you have a problem and to ask for help. There's help out there. You don't have to do it on your own. So, examples of recovery are very important. However, I want to take a minute and talk about the way examples of recovery are portrayed in the media. It is good to tell our recovery stories and to paint us in a positive light. I hesitate to refer to myself as a role model, but if people in my position to speak to the public about their struggles with addiction, if we are role models, it is so important that the media paints us as real people. I am not some shining, perfect beacon of recovery that doesn't have any problems. I'm a human being. I would like the media to portray me as such. I love what the Herald wrote about me last year. They quoted me saying, I don't have the quote with me, it was something along the lines of, I still stumble, I still struggle, I still have my issues, my bad days, whatever. More of that. Portray addicts in the media as real people, even when you are telling positive stories. I don't want to come off to someone who may see me as a role model as having achieved something unattainable. I want people to realize that we are real human beings. We're not fixed, we're not cured, we're just doing better than we were. Now, I want to talk about negative portrayals of addicts in the media. I brought an article with me today. This is from September 27th in the Washington Post. It's called, Drug Crime Experts Say Posting Shocking Photos of Drug Addicts is Wrong. Imagine that. It's wrong? Really? This article really resonated with me. There's some quotes in here that I want to share. What helps is getting people help, not public shaming. Public shaming reinforces the negative perception that we, people like me, are trying to eliminate. Stigma is one of the major reasons people don't get help when they need it. Good point. This article references images that have been circulating in the media and on social media. I know a lot of you have seen them, of passed out and unconscious drug addicts. Y'all know what I'm talking about? Particularly with children present. I know you've seen them. They've been all over Facebook. The media printed them. Photos of people unconscious on opiates with children around. These images have been circulating a lot in the media and on social media. Someone quoted in this article says, an implied message from those photos is that those people are subhuman. This type of journalism is sensationalist and a poor excuse for doing something about the problem on a societal level. We need to treat it as a healthcare issue. I agree. Now, this very same article, I retrieved it online, called Drug and Crime Experts Say Posting Shocking Photos of Unconscious Drug Addicts is Wrong, posted photos of unconscious drug addicts. In fact, the article included a 2-minute and 20-second video of the toddler trying to wake up a woman that passed out while she was shopping, and it says she later admitted that she had snorted fentanyl. It's like, don't do this. This is wrong. This creates stigma. And now click here to see this shocking video of an unconscious addict. Like, what? The hypocrisy is overwhelming. I actually shared this on social media, and then I kind of rethought it and took it down. I don't want people to see those images. Now,